You are not only my family, but a part of my life. And that is why in my practice I say that 8 to 10 goes to my children. And from where did I take out this 8 to 10? From my breakfast, lunch, and dinner. I just take my breakfast and dinner in just 2 minutes. So that we can spend time together. And I enjoyed spending time with you. Really, Lord, I thank you for giving me this opportunity to share the knowledge which you have given through this body to these people. May we be blessed by your grace, by your name, by your mercy. May the Lord, who is the ruler of the king of the kings, and heaven of the heaven, may he bless them. May the name of the God be signed. May his glory be praised, both in heaven, earth, and sky. May everyone be bowed to his name, to his mercy and glory. So do the name of the Father, so do the name of the Son and the Holy Christ. I pray for the mercy of all of you. May you all be blessed by his grace, mercy, and name. May Father who is in the heaven, the Father who is in the earth, and the one who rules the universe, bless each one of you. May the obstacles which has been created day and night be finished. May everyone be happy. May everyone be successful. May God give us success in all this field. May his name be praised in the entire world. May your name be praised. May the glory and the sacrifice which you are giving to learn this subject be blessed by the Lord. Lord, the shepherd of the kings, who has sacrificed his son for the sorrow of us, for the sins of us, may by the blood of his cross you be baptized. May your sins be baptized. May the blood of the cross clean your souls and purify it. May you be happy hereafter, thereafter, and so after. May God bless you in the name, in his mercy and glory. In the name of the Father, to the name of the Son, and the Holy Christ. To the name of the Father, to the name of the Son, and the Holy Christ. I bless each one of you, my children. You be happy, and let all the obstacles which are coming one day after the another be not there. I pray for Vinny, who has done a wonderful work. My all blessings for you, my child. I can only say, I can bless you, my child. Because what you have done, no one would have ever done. It was your initiative. It was you who have taken this. ये विनी थी, प्रकाश जैन थे, जिन लोगों ने ये पूरा इनिशिएटिव लिया, सब क्रेडिट इनको जाता है. मैंने तो क्लास छोड़ी दी थी. I have left this class long back. If Prakash Jain would have not come, it was his idea to start revision class. It was his idea to start Zoom class. I was totally against it. I said, why should I teach all this? बट ये सब अच्छा ही हुआ. जो हुआ परमात्मा सबकी भला करे, सबका मंगल हो जाए. And this is with prayer that things happen. In the name of the Father, the Son, and the Holy Christ, that things happen. Amen. Amen.
Amen.
Amen. This is what I was a parish priest, the symbol of what I have still.
Amen.
May God bring peace and prosperity to us, not ego and hatredness in our heart. Let us all support each other. This is what our brain teaches us. And this is how 100 billion neurons in our brain teaches us. So if you see our brain, Prakash ji recording chalu rakhe. Prakash ji? Hello? Prakash ji?
हेलो.
अभी स्टार्ट करना है या चालू है वही कंटिन्यू रखो?
आप प्रकाश जी रिकॉर्डिंग चालू रखिए, मैं क्लास में आ गया.
ओके, नहीं कंटिन्यू है, चालू नहीं. फिर से करना है तो स्टार्ट करता हूँ फिर से.
नहीं फिर से नहीं.
अब ये प्रार्थना ये सब आ गया उसमें.
चलिए ठीक है. जितने विघन है सारे हट जाएंगे. अब गणेश जी का नाम ले लिया, नमोकार कर लिया, सब विघन हट जाएंगे. See, our brain consists of 100 billion neurons. And these neurons, they are classified as in different areas. And then they work accordingly by establishing a network. This is called neural network. Write down. There is a networking in the brain by which functioning takes place. ब्रेन में एक नेटवर्क है जिसके कारण फंक्शनिंग हम लोग फंक्शन कर पाते हैं, हम सांस ले पाते हैं, हम खाना खा पाते हैं, हम हाथ मुट्ठी खोलते हैं बंद करते हैं। इसके पीछे ब्रेन का बहुत बड़ा रोल है, सारा काम वो करता है। हम उस चीज के साथ खेल रहे हैं जिसके पास 100 बिलियन सेल्स है, यानी एक पूरे भारत की समाज है, पूरी इंडियन पॉपुलेशन जिसके पास है। वी हैव इंडियन पॉपुलेशन इनसाइड आवर ब्रेन। इमेजिन हाउ टू फाइंड आउट वन प्रकाश जैन इन 1 million 100 billion people and get work from that. That is called brain stimulation. समझे मेरी बात? Did you understand? We have to find one neuron which has to trigger and has to solve our problem. And that is our experience. What we said is not the knowledge. What we said is our experience. That how this patient was revived and what we have done. So the primary. So now the most important thing is, this was the old opinion, I think, that the neurons cannot replicate, do not regenerate after injury. Yes, to some extent this is truth. इसलिए पैरालिसिस के ऊपर काम नहीं हो पा रहा था. But then when the concepts of G lymphatic system, concepts of neuroplasticity, angiogenesis, जिस तरह से रिसर्च बढ़ती गई, अब आज आप देख सकते हैं कि पैरालिसिस और ब्रेन से रिलेटेड जितनी 1000 सिंड्रोम में से 800 पर हम लोग आज काबू पा चुके हैं, just with the help of what dry needling. मल्टीपल स्क्लेरोसिस जैसी चीजों को हम बहुत आराम से खेल लेते हैं. स्पाइनल कॉर्ड इंजरी हमें ऐसे लगता है कि बच्चों का खेल हो गया. We are taking spinal cord injury not as a very big issue. Only the thing is that the one who follows up, he already develops so much spasticity that he cannot be recovered. Next. Next. You can see many things, many contributors to the field of neurology and neurosurgery and neuroscience. Even today, we cannot replace coaches. We cannot replace Dr. I.P. Chedian. We cannot replace certain neurosurgeons because of their excellence. जितने न्यूरोसर्जन की हम बात कर रहे हैं, कुछ चेहरे आप देख रहे हैं, इनके पीछे बहुत सालों का अध्ययन लगा, तब जाके आज हम उस जगह पहुंचे हैं. मुझे भी 35 साल लग गए एक बात को समझने में. हाउ टू मोबिलाइज द मसल्स, हाउ टू ब्रिंग मूवमेंट्स इन द मसल्स बाय नीडलिंग ऑन द स्कैल्प, सॉफ्ट टिश्यूज. सबको स्कैल्प एक्यूपंक्चर करते हैं. व्हाट इज स्कैल्प? हाउ कैन यू क्रिएट न्यूरोप्लास्टिसिटी इन द स्कैल्प? डिड यू एवर स्टडी? There's a plasticity and spasticity. Can you revive spasticity from the scalp? That part we have to understand. So this is the structure of a neuron. एक न्यूरॉन का जो स्ट्रक्चर है. अब आपने कल एक केस देखा था ना उस लड़के का. You seen yesterday one case? Do you remember that boy? Yes or no? With transverse
Yes, sir.
myelitis and all.
Yes, sir.
Now you can see there is a myelin sheet here. Do you see that myelin sheet?
Yes, sir.
Huh?
Yes, sir.
So this myelin sheet of that person was damaging. That means millions of neurons have been damaged, and henceforth he was not able to walk. यानी उसके millions of neurons damage हो चुके थे. I think more than millions and millions of neurons. उसके बाद अब वो चलना बंद कर चुका था. So you can see the structure. The upper structure is dendrite. Can you see my mouse? I'm moving the mouse. Can anyone see my moving? Or only I am moving the mouse?
Yes, sir. We
Yes, sir.
Yes,
can see your mouse.
So now I'm moving towards the action. Can you see the mouse towards the action? No, don't move the mouse. Let me move and see. Where do you see the mouse?
no, not seen now.
Sir.
So this is only with the coordinator,
Not
not with me. Yes. So I am not supposed to move it. Unnecessary I was moving. So you could see dendrites, nucleus, axon, myelin sheath, soma body, and this all about the neuron structure. This is the anatomy of the neuron. This is the fundamental anatomy of a neuron. एक न्यूरॉन कितनी मदद कर सकता है अपनी नेटवर्क की मदद से। अब प्रकाश जी को देखो कितना अच्छा नेटवर्क है, वो अपनी नेटवर्क की मदद से कितने लोगों की मदद करते हैं, कितनी चीजों को प्रिजर्व करके रखे। I have given Prakash ji more than 1,000 slides. He still preserves it. And today when I was left with nothing, he brought back me all my slides.
So your voice is very low, sir.
Now,
Yes, okay, sir.
Better.
can you buy me something which can help me to speak from this? I don't know what to buy.
I'll try, sir. I'll ask my brother. When I'll come, I'll get it.
Till then the class has to continue.
Yes, sir.
So anyone who can help me to buy me something from Amazon, please help me.
Yes, sir.
And next. So here you see the cell body, the neurological cells, the axon and the dendrite. This is the original stain of the neural cell you will see. So this is what you must understand. So now you see a neuroglial cells. You can see which is out of the cell body. Clear? What do you see? Dendrites, cell body,
Cell body,
neurological cells.
neuroglial cells, and axon.
Yeah. This is the primary part of the medical science. Next. Soma is called the cell body, metabolic center of the cell. So now we'll study something about the soma. It is called the metabolic center of cell. Typical cellular organelles, larger clear nucleus, nucleus mitochondria, Golgi apparatus, lysosomes. All these are the part of what? Common to all neurons. So there are many types of neurons, but these are all what? Common anatomical structure of the neurons. Yes. So you can see endoplasmic reticulum. See, endoplasmic reticulum means a characteristic feature of a neuron. एक न्यूरॉन की अगर फीचर है इन विच हाई कंसंट्रेशन ऑफ RER, इसका फुल फॉर्म हम देख सकते हैं, ग्रेन्यूल्स फॉर्म निसी सब्सटेंस। नेक्स्ट So now cytoplasmic fibrils, what you have seen, another distinguishing feature of neurons make up cytoskeleton. What do they make? Huh?
Cytoskeleton.
Yes,
Cytoskeleton, sir.
they make cytoskeletons. Next, finish.
No sound at all, sir.
I'm seeing. Anything else left? No. Next slide. Yes. Next. Next. Sometimes when we see a complex thing, how to make it simple, we try to analyze it. Now, if you see any types of movement disorders, the DMD or modern neuron disease or any other disease, 20% of the children they become what? Parasitic. Yes. Sorry. Because again I have to work up to 6 o'clock. So I take little sleep in the class. Just don't mind, huh? And if I sleep more, wake me up.
Okay, sir.
Next slide.
Next slide.
So please. One thing I tell you, there's no one for you to teach these subjects because no one has ever recovered any type of such cases. I'm the only one who has recovered. So I know how to recover a patient. I'm just giving you a basic idea by which you can help you to understand NIBS properly. Can you take a risk of recovering a patient in the terminal stage of Parkinson? I've done it with the help of stem cells. And my patient today, Thapa, who had a total transaction injury, is standing today with one hand. So that is the achievement we did in last 2 months. Now hope of recovery is full hope of recovery. Whatever you have done, you must understand little anatomy of the brain. The neural signal are receptions to a dendrite and the field of the cell. It is called receptive field. Now, what is the problem with you? You don't know anything about neural signals. How many know about anything about neural signals? Tell me. Anyone knows about neural signals? Any national, international person knows or next. Now you can say this is the way action potential and membrane potential take place in the brain. यही एक तरीका है जिससे न्यूरल कनेक्टिविटी स्टेब्लिश होती है. आप मुझे एक बात बताइए. How many people wants to recover paralysis? Say name by name. Those who don't have pain. जिसके पास पेन नहीं है वो मुझे बताइए आप पैरालिसिस कैसे रिकवर करते हैं. हाँ हाँ. Yes. Next. आज थोड़ा सा ज्यादा थकान आ गई क्योंकि आज 140 पेशेंट से ऊपर थे. अकेला आदमी 140 संभाले कैसे हो. IPOP both. I'll sit like this so that I don't sleep. So this is a advanced thing. I'll come to simplify it. So whenever there is a neural activity inside the brain, there are two neural activities inside the brain. What are they?
Chemicals and electricals.
Yeah, right. Chemical reaction is called what?
Sodium potassium exchange, ion exchange.
Action potential.
This is called as action potential. Right? And then accordingly with the help of action potential, neurotransmitters generate in the brain and they create neuroplasticity inside the brain. Right? Am I clear or wrong? Am I right or wrong? So, whenever there is a chemical and this reaction is happening inside the brain, you leave a neuroprotein inside it. अब ब्रेन के अंदर एक न्यूरोप्रोटीन छोड़ जाते हैं जो ब्रेन को कंटिन्यूस डिपॉजिट होने के कारण ये न्यूरल सेल्स को खा जाता है. फॉर एग्जांपल आपके ब्रेन में पैरालिसिस हुआ आपको, व्हाट डिड यू ट्रीट? डिड यू ट्रीट द ब्रेन और डिड द पैरालिसिस? एज पर रूल यू शुड ट्रीट द ब्रेन, बट यू आर वर्किंग विद फिजियोथेरेपी एक्सरसाइज. कैन यू रिकवर ए पेशेंट? I doubt. Next. So you can see how action potential creates a what? Chain of networks. So the signal which you insert in the brain in the right way. Can you hear me? Can you hear me?
Yes, but
Yes, sir.
if possible, please speak louder.
I don't have. Whatever I have, I can speak. My voice also has gone feeble. After speaking to 300 people, how much can I speak? Tell me. Now?
It's better, sir. Thank you.
So when you speak about brain, it's all about activity. Brain और क्या activity तो है वो. बट नाउ बिकॉज ऑफ डिस्ट्रप्शन कोई भी चीज डिस्ट्रप्टेड होती है. फॉर एग्जाम्पल आप देखो 2 दिन आप क्लास में डिस्ट्रप्शन आया, कितना कायोस क्रिएट हुआ, कितना ब्रेन ऑफ यूनिवर्स स्ट्रेस पड़ा.
सर कैमरा एडजस्ट करो. बस आपको देखते तो मजा आता है सर.
प्रकाश जी आपकी आवाज के कारण क्लास चल रही है, नहीं तो मैं सो जाता.
अरे आपको देखते हो ना तो बस मजा आता है.
ये क्लास का क्रेडिट ही आपका, सारी क्लास ही आपकी है. आपके श्री चरणों में समर्पित है.
अरे कोई नहीं.
मुझे आज भी याद है when I wanted to say I will never teach anymore anytime in the after the Lucknow seminar, the quality of the students. For the first time this person said people, you have to reach the right people. And today I'm in the international level only because of Prakash Jain.
Only because Prakash Jain.
The man whom you are hearing this voice is not a small voice. It's the creator of M.K. Shastri. And I'm happy the one who has created still is with me. If you can see me at international level, you can see these videos, all credit goes to him. He is the one who phones me for 10 times and he resolves all the issues of everyone. Like what Vinny does for this, he does for my Indian WhatsApp group, creating groups, creating people, bringing advertisement, bringing people. All this is done by Prakash Ji. Words are not enough to appreciate them. शब्द की कमी पड़ जाती है. उसी तरह से अगर ब्रेन में सिग्नल्स की कमी पड़ जाए, ब्रेन काम नहीं करता. उस ब्रेन को काम कराने के लिए ही हम लोगों ने स्टिमुलेटर्स यूज किए थे. Now, is there anyone in the Google who can write repeated transcranial magnetic stimulation? RTMS. Can you write RTMS? See, optimum, every membrane potential is not action potential. It has to reach a certain threshold. So to reach a certain threshold, यानी एक झटका लेने के लिए, एक उसमें एक्शन पोटेंशियल लाने के लिए, एक उसमें एक्शन लाने के लिए, उस सेल्स में जोश डालने के लिए सिग्नल डालना पड़ता है. उसके बाद आपका हाथ मूव करता है. मिलियंस ऑफ सेल्स वर्क टुगेदर टू मूव योर हैंड्स वर्क. एक भी थोड़ा भी डिसरप्शन हो जाए, आप पैरालाइज हो जाते हैं. और उसका करेक्शन मेडिकल साइंस में आज के दिन में नहीं है. अगर कोई आज बोलता है कि पैरालिसिस एक्सरसाइज से ठीक हो जाता है, तो आई डोंट चैलेंज एनीवन, but I have a most critical cases. Please come and show me how exercise has recovered patients. They sustains the patient. It recovers the atrophy. It has its own role. But for so far, the recovery of the brain is concerned, it cannot be done by whatever you think. It requires what? Certain threshold. This is what medical science says. And this threshold can be recovered by what? A cell called RTMS. You can see this is called RTMS. Repeated transcranial magnetic stimulation. This has been recently approved by FDA, but they are not using it in stroke. They are using in Thailand. They have used it in stroke, but they, in India, we cannot purchase it because the cost of this equipment is around 30 to 40 lakh rupees. We have been planning to import from China, but better to import. I thought that I taught you by CT scan machine. What to buy?
CT scan machine.
Yes. Because from CT scan, there is a 3D. From 3D, what you can understand? You can navigate the brain like this. I put you in the 3D. I take the scan of the brain. That 3D of the 3D city of the brain. 3D city of the brain. 3D city of the brain. 3D, three-dimensional, 3D city of the brain. Here you can see different structures. Now we have to reach this structure, the blue structure which is in the uh, first picture from the ES. How to find it? That this is motor cortex. Did you ever identify it in the CT scan? Did you identify it in the MRI? Did you mark this location? No, we did it. Now this is what we are going to do. Can you hear me?
Yes, sir. Yes, sir.
Am I
Yes,
clear?
sir. Yes, clear.
See, I cannot speak more loudly than this. Because I have to preserve my energy for the whole night work. That is why you know me. Why? Because I can preserve patients and I recover patients. If I could not preserve and recover patients, will you ever know me? Will you respect me? No. Rest is air. Only those people who can preserve and respect. Generally in India, who is at the head of the department of the institute is one of the best professors. Why? Because all the critical cases goes to him, whether it's an assistant professor or professor. He remains like HOD. Why? Because he can manage the critical case. Any critical case comes, the request goes to him. Please manage. Similarly, any critical cases are found by my students. They directly refer it to me. Why? So these neurons are damaged by what? The proteins which are generated during the chemical reactions. And then the G lymphatic system, cleaning and cooling of the brain, removes this what do you call it? Proteins from the brain. And from removal of these proteins only makes your brain healthy. That is why it is said, take a deep breath. यानी ये जो भी केमिकल रिएक्शन हमारे ब्रेन में होता है, ब्रेन में दो रिएक्शन होते हैं. क्या क्या रिएक्शन होते हैं? इलेक्ट्रिकल, जिसको हम बोलते हैं मेम्ब्रेन पोटेंशियल. सेल की जो मेम्ब्रेन होती है उसमें एक रिएक्शन होता है, इम्पल्स होता है, एक स्टार्टिंग इम्पल्स होता है और एक सेकंड इम्पल्स होता है, जिसको हम बोलते हैं एक्शन पोटेंशियल। व्हेन इट रीचेस अ सर्टेन थ्रेशोल्ड, यानी एक थ्रेशोल्ड रीच होने के बाद, थ्रेशोल्ड मतलब जितनी उसकी जरूरत है उसको उतना मिलते ही वो कैल्शियम आयन चैनल्स खोलते, जो न्यूरोट्रांसमीटर वेसिकल्स के अंदर है वो निकल कर दूसरे सेल की तरफ चले जाते हैं। दो सेल के बीच की जो जगह है उसको सिनाप्स कहा जाता है। क्या कहा जाता है?
Synapse.
Synapse. But now, if there is a protein deposited inside the brain, like amyloid beta protein, which is intracellular, and extracellular is a tau protein, then you suffer from Alzheimer's or Parkinson or any other disease. That is why it is said, never quarrel, never fight, because this generates proteins inside the brain. इसलिए कहा जाता है ना कभी लड़ाई करो ना झगड़ा करो, जैसा है उसको मैनेज करो। Am I clear?
Yes, sir.
Sastri.
So 9:30 has happened. Gradually, time will increase. People are joining this group. I'll be able to give it 2 hours definitely. But the workload is high over here. And the criticality is also high. But we are learning. That will help you to understand more to solve critical cases. You will be known for your practice. That's all what I want. आप जो practice करते हैं, you see, Avinash is a medical representative, but he is known, he is, by the patient he goes to you. From there I come to know, baap re, such patients would have never come to me directly if you don't refer. ऐसे कचरा पट्टी पूरी आ गई, बाप रे बाप, कैसे संभालूंगा मैं अकेला? But then I saw the patients recover. I have a very deep respect for all of you, for all whatever you have done. I may not respect you from my words, but from my heart, there is a deep respect and blessings for you, because you all have done a wonderful job. You are working with the brain. You are trying your best, and still you are upgrading yourself at mid of the night. Thank you so much. You may close the slides. It will take time. So you may put up your questions. अपना सवाल पूछिए. Every day I give around so much injections here, 600, 700 injections. You see what has happened to my hands. I can't make my hand. Tendonitis has happened. But then I saw people recovered. I saw the happiness in that people. You cannot satisfy the people. Satisfaction is not my job. But recovery of the people is my job. So you may ask your questions now. Ask your questions. दाढ़ी भी काफी बढ़ गई. I do not get time to save also.
Hi, Ji.
Ah,
With our current situation of COVID, and also I think you have been infected several times. Which part of the brain you think is there a way to overcome this issue?
see, it is very difficult to identify. I have not identified many MRIs. We got only those MRIs which has
कितने बजे तक
hypoxic brain.
कितने बजे तक पूछो पूछो
उनको mute कर दे. See, the question is, Roni, we did not overcome through that research by which we can understand which part of the brain can help you to overcome this. But yes, there is a very good role of the hypothalamus and a deep breathing exercise. Because G lymphatic system is the only system which purifies the proteins of the brain. Proper breathing, proper exercise, proper thoughts, and proper food. These are the 4 things which has helped people to sustain in COVID. And the cases which we got was hypoxia, means lack of oxygen in the brain, and we have received only coma cases. So we can speak about those cases what we have treated. We cannot say about those cases which we have not treated. हम जिस केस को ट्रीट ही नहीं किया उसके बारे में मैं कैसे बताऊं कि वो क्या इफेक्ट हुआ. हमें जो केस मिला वो कोमा का पेशेंट मिला जिसका ब्रेन डैमेज हुआ है 80 से 90%. उन पेशेंटों के ऊपर हम बात करें तो आपको क्या समझ में आएगा. Recently a patient is with me. His 80% of the brain is damaged. If you see his MRI, his wife came yesterday, said, "I'll divorce my husband. I cannot tolerate him." But you see, with just inserting few needles, his behavior has changed, and today is very happy. All family is happy. All what we need to adjust with the people, not to be angry with the people. If we are angry, we release our own negative neurotransmitters, neuroproteins, which damages our own brain. We are not there to live an unhealthy life. We are here to live a healthy life.
So which part of the brain do you treat?
I think it is always better to take a deep and proper breathing.
Sorry?
Deep and proper breathing.
So
Deep and proper breathing.
yeah, so in other words, actually, if it's a COVID, can it be treated like acute asthma?
See, acute asthma did not come to me because...
No. I mean, in terms of the concept.
No. See, we cannot create a concept until we treat a patient.
But because they attack the respiratory...
No, everything is okay. But until we treat a case, how can I say that? Cases which has come to me, cases which we have seen through Zoom, WhatsApp in different hospitals, we know about the conservative treatment. I also did not do much research in that. Conservatively, I know hydrocortisone, derifylin, and all this can be given. If the D-dimer is high, okay, put it in higher medicines.
But in your case, each time, is there a difference?
This time the Omicron virus was very low. We did not find any complexity in the patients. Patients are very simple with minor weakness, which we reduced in just simple brain stimulation. So our brain stimulator and massager is different. We make it like this. And the circuit is different. It is locked. I'll show you the circuit. So every pen, they have also changed the circuit, but they don't know how to use it. I don't know what Chinese are doing, because these people replicate things very fast in the country of China. But here we did authentic research and we found an authentic product, and we found it is useful for the whole society. Without brain, without NIBS, nothing can be stimulated.
Sir, good evening, sir. This is Sangala. One kid, 5 years old, sir. He's suffering from generalized seizures. His MRI showing demyelination of neurons, axonic. Is it possible for us to treat him?
See, now the question is that medically, all the neurological cases, 90%, if you see the book of Harrison, I think you read the book Harrison.
Sir.
You are a physiotherapist or Ayurvedic doctor?
Pharmacology. I'm a pharmacology.
So if you read a book called Harrison, it has been clearly written, 99% of the neurological diseases cannot be cured. And 85% has no treatment also. We are treating them with very few drugs we have. So pharmacologically, we cannot treat a patient. Clinically, we cannot treat a patient. So, but if you think about me, I always work with this type of patient. You come and see, there's a forceps child, there's a demyelinated child, delayed milestone, typical type of CP. You could see the first photo. He was the child who could not even sit, today standing and walking with mind, ground clearance. Let my physiotherapist come and I'll show you different types of videos. Avinash is going to buy me one good mobile because it is not collecting one good pictures. So you will see. Definitely we are hiring one photographer also to give you good pictures, videos, all the glimpse of our clinic. It's not a clinic anymore. It's a center which is converting to 200-bed teaching hospital. So we are buying MRI also. We are buying CT scan also. Certain machines are on the way. RTMS we are going to buy. To only prove you that we have no machines for brain stimulation. RTMS is useless. You may, FDA may approve it for depression, but what about stroke? We are dealing with stroke. No psychiatric patient comes to us. साइकेट्रिक का कोई पेशेंट आता अपने पास, मुझे नींद नहीं आती, वो तो सेकेंडरी प्रॉब्लम है. प्राइमरी प्रॉब्लम भाई साहब, ये साइकेट्रिक केस आप डील कर पाएंगे? ब्रेन को कभी नेविगेट किया है? ब्रेन की कौन सी एरिया को टारगेट करना है? मैंने तो एक ऐसा सिखा दिया कि भाई इस ब्रेन को इस तरह से टारगेट कर लो. आपने कभी उसको टारगेट करने का सोचा है? न्यूरो मॉड्यूलेशन के बारे में समझा है? नहीं समझा ना, तो फिर कैसे स्ट्रोक क्लिनिक चलाएंगे? मैं देखता हूँ आप कचरा से कचरा केस लेने की कोशिश करते हैं, बट रिकवरी बहुत पुअर है. इसलिए इस बार जो भी मेरे पास सेमिनार में आए, जो पेन खरीद कर सकते हैं, जो अच्छा कर सकते हैं वो आए, जो नहीं कर सकते वो मान्यता है. ये मेरा एडवाइस है. नेक्स्ट.
Sir, can dementia be treated?
See,
or
I have treated a dementia of 85 years man. I told you Shravan also was there. It was publicly acceptable case. The case is in my Facebook. This man was having hallucinations in the evening. It was like a birthday party. He forgot everything. I have recovered him. And I have recovered that case 7 months back. Almost 7 months, right? That person is still okay. And he remembers everything, every name, every memory. And now his wife has gone back to job and he stays alone at home.
Sir, can dementia linked with Alzheimer's disease?
Dementia can be dealt with Alzheimer's disease because there are two types of Alzheimer proteins which affect Alzheimer's. One is amyloid beta protein, intracellular, one is extracellular. Now you have to create a pathway of G lymphatic system by which these proteins are deposited proteins can be removed from the body and passed through the urine. That part we have to study. Or one more thing we can understand is vascular anastomosis. Vascular anastomosis means you can do vascular grafting in the weak areas of the brain, so the proper circulation of the, that area may revive the neurons and you can recover.
Sir, will stress play in this role?
Huh?
Yes, stress will play a role in these things.
Stress plays role in everything. In Hindi it is a chinta chitta banati hai. Means because of your stress, you create your own graveyard.
Yes, sir. Thank you, sir.
Thank you. May I know who's speaking?
Myself, Mohammad Ibzullah from India, BPT second year student.
हाँ, बहुत अच्छा बेटा, बहुत बहुत आशीर्वाद बेटा. अल्लाह रहम करे, अल्लाह करे बेटा. बहुत सुंदर, बहुत बढ़िया, बहुत अच्छे सवाल, बहुत अच्छे जवाब, बहुत सुंदर.
Thank you, sir.
बहुत बढ़िया, बहुत बढ़िया, माशाल्लाह. ऐसे बच्चे हो तो रोशन हो जाए, रोशनदार.
Sir, one more question, sir. This is Ravinder Sangala.
हाँ रविंदर जी, please.
Sir, catgut embedding method, patient will benefit instead of injecting some like stem cells or PRP. Instead of giving PRP, will it work, sir? Catgut embedding?
See, I don't believe in catgut embedding much.
Sir.
Because we believe that the immunity of the body has gone, right?
Sir.
So how can you have the immunity of the body? We have revived very critical bronchitis case by just stem cells. You see in one photo I've seen today, that boy is training with one hand, whose total cord is transected in two pieces. I think that credit should go to stem cell and brain stimulation and my small people, my nursing staff, and this boys revived the case. Next question.
Sir, can COSM be treated by
Full form?
chronic otitis media?
What are the symptoms of the patient?
40% hearing loss, 20-year-old boys.
See, I have recovered many hearing losses. Even in Malaysia, if you see the video, Rashmi has come all the way from Australia. She's been practicing MD 22, 25 years in Australia, and she charges around $500 for 1 hour practice. How many dollars? $500 Australian dollars. यानी 1 घंटा की उसकी प्रैक्टिस की कीमत है कितनी? 40,000. She came all the way from Australia to learn from me. And still she is my student. What does she say? She has seen a child who lost his hearing loss. And we have revived it. But we don't have, I don't want to work in hearing because brain में इतना काम बाकी है, hearing में काम हो सकेंगे.
Okay, sir.
Pain, paralysis. Eyes I'm going to work, especially with RP and all. मैंने पूरी आई यूनिट खरीदी है. अब आप लोग भी देख सकते हैं कि आई का पावर जो मायोपिया, हाई मायोपिया है, ये सब कैसे कम हो सकता है. Because we have units. Medically we will certify, documents will publish. इतने दिन तो हवा में बात कर रहे थे ना, अब तो डॉक्यूमेंट, अब तो EMG मशीन आ गई. अब तो ये पता कर सकते कि एनसीवी, कल का एनसीवी और आज के एनसीवी में कितना फर्क है. डॉक्यूमेंट्स बात करेंगे ना. आप लोगों ने, कलकत्ता वालों ने, कितने लोगों ने मुझे कहा, मेनी पीपल सेड मी दिस पेन इज फेक. इवन इन मलेशिया पीपल सेड मी दिस पेन इज फेक. The one who does not know ABC, they are speaking this. Please bring those people and say recover the patients. Those who were shouting, he is dead, with all due respect to him. But can he recover a paralysis patient? And all these people, Mrs. Kaur, Dr. Kaur, she is MBBS. Please bring her near me and please let us see how much she can recover a paralysis patient and how much I can recover. Put talk on the table, na? You all are talking behind the table. Why don't you talk to me on the table? This is a patient and to talk to about the recovery. Let us see the anatomy of the patient and talk about the recovery of the patient. What you can do and what I can do. Let me see how high doses of vitamin C can be non-toxified. I am giving a low dose of vitamin C and they are working on the patient. We have revived certain difficult cases which are on Facebook. Just putting courses, cheating people is not medical science. I don't know how does qualified doctors get in grip of these people. Because your basic knowledge is not strong, so you get. Indian doctors, you say, they will catch hold of your neck. In India, we don't do all this. We catch the neck. Even in my seminar, they catch my neck if my knowledge is inferior. Even my knowledge is superior, they catch my neck. I have recovered the patient. I have my patients admitted here. Then I say, do something and so. Within 10 seconds, 20 seconds, 30 seconds, this is a stopwatch. I do it in 30 seconds. This is the result. You check. Now let you try and do something in 30 seconds. करेंगे कैसे? ये पेन के ऊपर ही आपका कंट्रोल नहीं है. You don't know how to hold a pain, how to stimulate the brain. बाजार से एक मसाजर पेन खरीद लिया, उससे स्टिमुलेट कर रहे ब्रेन को. पता नहीं कहाँ से क्या सीखा. Who taught you what I do not know? From which book, which lesson, which chapter, which paragraph, which line has taught you? That is also a question mark. I'm not saying about you people. I'm saying about all those people who will hear this lecture. कौन सी किताब, कौन सी लाइन, कौन सा पैराग्राफ, कौन सा चैप्टर, कौन सी किताब से क्या समझा, मुझे ये नहीं समझ में आता. पैरालिसिस को तो घर का ससुर समझ के रखा आप लोगों ने. जब जैसे मन में आए वैसे ट्रीट कर दो. मतलब पेशेंट की लाइफ बर्बाद कर दो. हमें क्या फर्क पड़ता बड़ो, 6 महीना क्या, 10 साल हो व्हील चेयर पे. जिंदगी आपकी है, आपकी कटेगी. इसलिए हम लोगों ने तुरंत स्टेम सेल्स लागू किया. And not only that, tomorrow we are going to do stem cell on 1-year child, 2-year child, very peacefully. In the lowest cost, 6,000, 7,000 rupees. Whereas in Mumbai, it takes lakhs of rupees. We bought the cost to 6, 7, and it is authentic. We'll show you the bone marrow in the microscope. We have purchased it. We'll show you the stents of the bone marrow. This is the bone marrow of the patient, you can see. We don't have the cost to buy the electronic microscope. And I advise every person should go with stem cell therapy. I was very against it because of the cost. But now the cost is low. All those who are feeling weak, diabetic patient, all should go for stem cell therapy. 30-40 हजार रुपये अपने ऊपर खर्चा करने से आप बीमार नहीं पड़ेंगे. प्रकाश जी, अब आप आएंगे तो मैं आपको स्वस्थ कर पाऊंगा, क्योंकि मेरे पास स्टेम सेल थेरेपी है.
क्या सर?
आपकी तबीयत बिगड़ जाए, आपकी तबीयत तो वैसे भी थोड़ी बुढ़ा गए, आप मेरे पास आइए, मैं आपको जवान कर सकता हूँ, आपकी सेल्स को रिवाइव कर सकता हूँ, आपके बॉडी के ऑर्गन्स, आपके हार्ट को, आपके शरीर को मैं आपको टकाटक कर सकता हूँ.
ठीक है.
आपकी एनर्जी को भी बढ़ा सकता हूँ बाय स्टेम सेल थेरेपी. जो स्टेम सेल्स हम लोगों ने कल्चर किए हैं, दे हैव रिवाइव्ड स्पाइनल कॉर्ड इंजुरीज, उन्होंने काम किया है. इट इज एन एग्जांपल. यू विल सी दिस बॉय इज वॉकिंग.
तो सर ये स्टेम सेल थेरेपी एक्यूपंक्चर से होगी या
नहीं? देखिए, स्टेम सेल का मतलब होता है, ये नियम से एक्यूपंक्चरिस्ट नहीं कर सकते, पर इसमें आपका रोल कहाँ आता है? ब्रेन स्टिमुलेशन में.
अच्छा.
स्टेम सेल का मतलब ये होता है कि हम सीधा एक लकड़ी लेते हैं, ये बोन मेरो में जाते हैं, लकड़ी मतलब वो नीडल लेते हैं, और बोन मेरो में लोकेशन से जाकर ऐसे खुरोच देते हैं, मतलब गड्ढा कर देते हैं. वहां से हम ब्लड निकाल लेते हैं, वो बोन मेरो निकालते हैं. उसके बाद हम उसको अलग तरीके से कल्चर करते हैं. वो कल्चर में से यू विल सी 3 layers. First layer will be very small layer. Soni, Dr. Soni is there? Dr. Soni? Lady doctor? Soni homeopath, are you there? चले गए होंगे ये तो. तो वो 3 लेयर होती है, 1, 2, 3. नीचे वाला आरबीसी होता है, बीच में प्लाज्मा होता है, उसके ऊपर स्टेम सेल होता है. ये दोनों को कंबाइन करने के बाद अगर आप उसको आरएल के थ्रू दे, इंट्रावेनस, मेरा बात था लुम्बर पंचर प्रोसीजर, इट्स ओनली गुड फॉर स्पाइनल कॉर्ड इंजरी पेशेंट्स. अदरवाइज हम लोगों ने प्लाज्मा और ये सब दे के पेशेंट्स को बहुत हद तक रिवाइव किया है. एंड रिजल्ट्स बहुत मुश्किल से आते हैं. उतना पेशेंस होता ही नहीं है लोगों में, क्योंकि पूरी न्यूरोपैथी हो चुकी होती है. जब तक आते हैं तब तक पूरा नर्व ही डैमेज हो चुका होता है. इट इज नॉट द डैमेज अबाउट द कोर्ड, द एंटायर peripheral nervous system is damaged. You see, one patient was brought by Ravinder Sangla, who used to repeat words, that small girl. वो बार बार एक ही शब्द को रिपीट करती रहती थी. Now you see, she has recovered by 50%. यानी मुझे पता चला कि इन बच्चों पर और अच्छा काम कर रहा है. अब तो मैं सीपी चाइल्ड, ऑटिज्म, हर तरह के बच्चे आ रहे हैं मेरे पास. बीच में तो ये सी हालत हो गई थी. द कंडीशन इन बिटवीन वाज लाइक दैट. पीपल यूज्ड टू आस्क मी, सर डू यू ट्रीट पेन और पैरालिसिस और ओनली यू ट्रीट सीपी एंड ऑटिज्म? I said I started with only one patient. I have so many kids and all have improved. So that part you have to see. और कोई सवाल जवाब? Questions please. Time हो गया जाने का. Any questions?
ओम शांति।
Questions please. कुछ लिखा है? Can you read?
सर मेरा चाइल्ड सीपी है, थोड़ा टेक्निक्स बताना कैसे
देखिए टेक्निक से रिकवर नहीं होता.
लाऊं सर? क्लिनिक ला?
क्लिनिक में लाए मैं कर दूंगा.
ठीक है सर, थैंक यू सो मच सर.
Don't do anything which you don't know.
यस सर, यस सर.
Don't play with fires.
सर
We are here. We'll help you. Don't worry.
थैंक यू सो मच.
For me, it is 1 minute job. For you, 1 hour job. Why do you
Yes,
waste
sir.
1 hour for that? कौन सांगला जी बोल रहे हैं ना?
यस सर, यस सर.
कोई बात नहीं सांगला जी, आपने तो वैसे मेरे को वो गिफ्ट दिया था. There is no.
नो नो सर,
कोई बात नहीं, आप लेके आइए. I'll recover that.
थैंक यू सर.
More questions, please. He was asking me that is there any technique to revive CP child? Can I teach him? I said, see, it is a procedure. The problem with you is that you are thinking about one technique or two techniques. When I'm teaching in the revision class, you don't understand. Here I'm teaching you about the systematic part of the brain. Then also you're not understanding what? You are trying to treat a brain in an unsystematic manner. I don't know what you will create at the end of the day. You will spoil the life of the child. And most of the childs are spoiled treated by you. This is my experience of 35 years. सीपी चाल तो ऐसा ही होता है, सीपी तो वैसा ही होता है. I don't blame any one of you. None of the pathies I blame. I blame the individuals who have been doing and want to do. For the sake of money, I don't know what you all are doing. So मेरा यही advice है, those who want to study seriously about acupuncture and medical science. It is not only about CP. There are hundreds of diseases, I tell you. Drooling of the mouth, this, that. You will learn. Tongue acupuncture is very finest acupuncture I am teaching right now. अभी सीख लो, बाद में ये क्लास भी नहीं मिलेगी.
सर
हाँ.
तो कोई क्वेश्चन नहीं है, संपन्न करो.
Before going, I want to say 24% of the contribution I am giving to Prakash Jain for all his work. तो जो भी कलेक्शन आया है उसका 20% का हिस्सा प्रकाश जी का है, प्रकाश जी का है. ये मैं ऑफिशियल डिक्लेयर करता हूँ कि उन्होंने बहुत मेहनत की है, बहुत लगन से मेहनत की है, सारे दिन लगे रहते हैं, और कुछ पैसे मैं आपको ट्रांसफर जल्दी कर रहा हूँ. ठीक है प्रकाश जी, बहुत बहुत
सर
धन्यवाद.
मैंने ये नहीं बोला.
आपने जो भी बोला, मैंने जो बोला वो बोला कि 20%. मैं ऑफिशियल आदमी हूँ. आई डोंट डू एनीथिंग इनऑफिशियली. मैंने एक चीज सीखी. आई एम सिटिंग इन द पोस्ट ऑफ ए डायरेक्टर in the Institute of Neurosciences, which will be 200 bedded teaching hospital. इनऑफिशियल काम करना बंद कर दिया हमने.
क्लास संपन्न करने के लिए बोलता हूँ.
आपने क्लास संपन्न करने से पहले उसको एक कंक्लूड कर रहा हूँ. I am a director of Institute of Neurosciences, which will be 200 bedded teaching hospital or 300 bedded teaching hospital. One of the largest, I think in Philippines also you don't have. And after 1.5 year, we are buying 3 Tesla machine. 1.5 year, अगले साल तक शायद हम 3 Tesla machine भी खरीद लेंगे, and functional MRI भी खरीद लेंगे, to prove that how acupuncture works. I think it will be the best. I think we'll cross Shanghai University in few years. 2 साल के अंदर हम संघाई को पार कर जाएंगे. This will be the epicenter of learning, because here we'll teach you how to recover the patient. All are welcome, those who want to learn, but learn properly. If you don't have a basic knowledge, don't come to us. But only having a basic knowledge, come to us. Similarly, a lady came to me, she does not even know how to operate a KWD. It becomes difficult. We get scolded by the patients if you do some mistakes. आप डायरेक्ट पेशेंट के साथ डील कर रहे हैं. तो चलिए, थैंक यू सो मच.
Thank you so much,
Yes,
sir.
good night.
Good evening, everyone.
Thank
Good
you,
night.
sir.
Good night, sir.
Thank you so much.
Good night. Thank you so much.
Thank you, Vinny. Bye.
Good night. Thank you, Winnie.
Dr.prakash and everyone while listening. Bye.
Shutting down. Good night, everyone.
Okay, night, Winnie. Thank you.
Night.